Hello, everyone. My name is Dr. Abi Abraham, and I'm a consultant primary care physician. I'm here today to present a series course called Easily Missed. There are going to be many, many talks in this series. And I decided to have this talk because over my decades of experience, I have found out that there are lots of people who really just need a little bit of information to help them to make up their mind with regards to their medical problems. And sometimes there are times when their conditions have been easily missed, and just because of not coming seeing the doctor in time, and sometimes even just a bit of not understanding what exactly the problem was. And so I am here with a burden to ensure that you spot this easily missed condition so that it doesn't become a forever missed situation. And so it's going to be really interesting. Make sure that you listen very intently, and you can always ask me questions at the end. Just before we go on, there's going to be a little disclaimer, and that really is that this content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have with regards to any medical condition that you have. So we're just going to go on very quickly and dive into it. I dedicate this talk to October, with the month we're in right now, which is the Breast Cancer Awareness Month. And you see, in this month, charities all over the world, they highlight breast cancer, its diagnosis, its management, and the research that has been raised around it. They also raise funds. The campaign offers information and support to those affected by breast cancer. Today, we remember those who have fought bravely and lost their lives in the battle against breast cancer. May their souls continue to rest in peace. We also remember those who are still fighting. I just want to say to you today, there is hope. Because of the research in breast cancer, there are so many therapies that are working. And I want to give you some news today. We are actually winning. We are winning. So hang in there. I'm going to talk to you today about this 39-year-old lady. There's a quick thing. Her name is Truveda. I have a couple of people to share the information with you. Now, this information I'm sharing with you is not really true to any one person in particular, but it is true to life. Names obviously have been changed for confidentiality purposes, but this is a true to life situation where 39-year-old Truveda had a breast rash, and there was no improvement after 4 weeks of the doctor's treatment. But she had no lump, and she was referred to the breast clinic, and there was a diagnosis of early breast cancer. She was treated successfully, and now she has an all clear. Just to show you that there really is hope when it comes to breast cancer. There's nothing to be afraid of. Also, to let you know that breast cancer, there are many symptoms to breast cancer apart from a lump. I will share some bad news with you before we move on to the good news. There are lots and lots of good news today. Now, the bad news about breast cancer is that it is the second leading cause of cancer death amongst American women. But the world, globally, it is the first leading cause of death. Every minute, one woman dies of breast cancer. Uh, in every woman, every minute, somewhere in the world, a woman dies from breast cancer. Uh, and there are over 1,400 women who die from breast cancer daily. Um, and that is really something. A man's lifetime risk is about 1 in 1,000. So men also have it, but much, much less than women. And almost 50% of the cases and 58% of deaths occur in less developed countries. So, especially obviously Africa is lots of development going on in Africa. Lots of African women do have this breast cancer, and like you can see, half of the world's burden of breast cancer is in the developing world. But the good news is that women who get regularly screened for breast cancer, they have a much lower risk. You can see Truveda there. She has she's victorious, really. She has overcome, and now has a 5 year. She's 5 years clear, and that's really just how it's going to be. Because once a person is 5 years clear, most likely that's just how it's going to be. The good news also is that the deaths have been declining since 1990, thankfully. And in the United States today, there are more than 3.5 million breast cancer survivors, and it's the same in most of the developed countries all over the world. Though in the developing countries where we're lagging behind a little bit when it comes to the breast cancer survivors. I'd just like to share a few myths with you today and the facts with regards to breast cancer. Only there's a myth that says only women can get breast cancer. I think I've already bust that myth. Men can also get it, even though there are much less men who get it. There's another myth that says only older people can get breast cancer. But you can see from my example, and even from my own clinical example, there are quite a few ladies under 40 who have breast cancer. And I'd like to state that alcohol definitely, consumption of alcohol can increase your risk of developing breast cancer. There's also a myth that only people with genetic mutations can have breast cancer. No, no, no. It is possible that sometimes, even when there's no family history of breast cancer, it comes up. There's another myth that says that you can't get breast cancer if you haven't had a child yet. Can I just bust that myth and say women who do not have children, uh, they don't have children, uh, also have breast cancer. Women who've had children have breast cancer, and so that there's nothing about that is accurate. So you can't say that if you haven't had, you can't get breast cancer if you haven't had a child yet. That is not correct. The other thing I'd like to share with you is ways you can prevent breast. That is good news. Check your breasts. I'm going to share a little bit of that with you later. Do not smoke. Smoking has been associated with a rise in not just breast cancer, but many breast cancers. Then the next one is be a healthy weight. I'm going to be looking into this one by one in the next few series I have. Limit alcohol. Your alcohol has to be limited very low, because alcohol, like I say, has been seen to be linked. Also get active, make sure you exercise all the time. And when you have a baby, ensure that you breastfeed your baby. That is so important. Don't just give the baby formula milk from day one. Breastfeed for at least 6 months. It's so important. Um, Now, this is a very important slide that I am going to spend a little bit of time with and that is checking your breasts and knowing your lemons. There is this website called knowyourlemons.com. I would advise you to please go to that website and subscribe to it. I don't know the, I don't have any affiliation with those who have created this website, but I have checked it, and it is really a good website. There are lots of questions there, and lot of information there. So here is 12 ways that breast cancer develops. Like I say, just to emphasize it again, it's not just if a person has a lump that there's breast cancer. You can see on the left here, first one is when a person feels a thick area around their breast, or there's a dimple. You can see that dimple on the left side around their breast. Or there's a crust on the nipple that sometimes looks like eczema. And so this was what Truveda had. She had this crust, funny type rash, which the doctor gave medication for, creams. It didn't work. So after 4 weeks, she was referred to the breast clinic, and they diagnosed early cancer. And now she's cancer free because of the successful treatment. And so again, sometimes when it is red or hot, I'm not saying every red or hot breast is cancer, definitely not. But when you see these changes, please do see your doctor. It's absolutely important. New fluid, again, I'm not saying all new fluid is a cancer, especially when you are not breastfeeding, but especially if it's blood stains, that is a little bit of a red flag. But if it is just water or milky discharge, then that's not a big thing. But still, it is very important to see the doctor. Skin sores. So when there are sores on your breast without pre-existing trauma, that definitely needs to be seen by the doctor. Or if there's a bump, so it's not a lump, but it's a big bump that needs to be seen. If there are growing veins, on the breasts and you're not pregnant and you are not breastfeeding, that is definitely indication for you to see your doctor. A sunken nipple, again, is one of the symptoms. A new shape of the breast, orange peel skin, or a hard lump. So this, I feel, it is really, really a very important post and picture, which you can, once you go to knowyourlemons.com, you can get it and share it with your friends. It is so important. It is absolutely important for people to know that even all these signs could point to something. And it is absolutely important for you to make sure that you know your lemons and you are very, very informed of what is exactly is happening. Now, meet Helen. We're still talking about checking your breasts. Helen is a 67-year-old lady who had mammogram detected breast cancer. So remember I said in the last slide that there are lots of symptoms when it comes to breast cancer, but sometimes there's no symptom, and the only reason why people know that there's breast cancer is because the mammogram had detected that cancer. So she was shocked because she had no symptoms, but the cancer was treated successfully. She was given the all clear, guess what, 23 years ago, and she is still cancer free. I'd like to tell you today that Helen's problem is not cancer. Definitely, she has moved on to other things. I don't know if you can see this, but she's holding a placard. What do you think she's going to write on that placard? I'd like you to send me a message and let me know what you think Helen is going to write on that placard. Look at her broad smile. She is definitely looking healthy and she's cancer free. That is amazing, isn't it? Now, what is a mammogram? A mammogram is an X-ray picture of the breast, which helps doctors and health professionals to exactly diagnose the almost microscopic area where the breast cancer is developed. You know, it is such a great detective. Well, it's such a great detective because it could take up to 3 years for that cancer to develop. And yet, once the mammogram has shown the cancer, it can be nipped in the bud. So it really is the best test for early detection. And but the age accepted for mammograms is really from 40 years old. Every 2 years, have it every 2 years. But again, it depends on the country where you live. Some countries have mammogram tests every 3 years. Some have mammogram tests every 2 years. Now, I'm sure you would ask me, there's a question that's ringing in your brain and you're trying to say, what if you're under 40? Well, the issue with mammograms under 40 is that there are so many false positives with people who have mammograms when they're under 40. The breast tissue is very dense at that time, and it shows up a lot of lumps that really are not cancer, they're just breast tissue. And so we're going back to the Know Your Lemons slide. I'd like to suggest for you every woman, regular self breast examination. Have it done once a week. No, sorry about that. Once a month before your periods, after your periods. So probably twice a month will do. And just make sure that you check your breast. Now, to get breast examination tips, you can go on the internet and just look for breast examination, how to conduct your breast examination. And you have lots of slides that show you what to do. It's really, really interesting. I'm finishing right now, but remember, breast cancer is practically 100% curable when it is caught early. If you see a lump, if you feel a lump, see your doctor immediately. There's still a big chance of a complete cure. But even if you have been diagnosed, research has produced numerous and very effective. So it is good news. Please do not be afraid. If you have any problems at all, make sure you see your doctor and they would refer you on to the appropriate. So thank you very much for listening to me. My name is Dr. Abby Abraham, and you can check me on drabbyabraham.com. And my Instagram and Facebook handles are also the same thing at Dr. That is spelled DOCTOR, drabbyabraham.com. Thank you very much. And remember, prevention is one of the best cures. Keep healthy and keep strong. See you very soon.